Hi, Dr. Frank Johnson from Sport Medicine Ultrasound Canada. I'm going to show you how to scan the medial elbow. So the patient position is usually side-lying towards me because it's kind of challenging to get that shoulder into a comfortable position. Now the landmark is going to be the medial epicondyle of the humerus, and I want to get that kind of in the center of the ultrasound screen, or center of the probe. So the orientation of the probe is going to be long on the forearm. The movements are going to be some slight micro movements of the probe sliding towards the shoulder or away from the shoulder until I'm sure that I've got a really pointy bit of that medial epicondyle in view. And then again, I can also make some slight fishtailing motions or angulation of the probe to make sure I've got it nice and bright. Now, the area of interest is going to be between the medial epicondyle, and a lot of times you'll actually get the ulna in view. And so we're looking at the tendon just as it attaches onto the bone, but then also looking at the ligament just deep to the tendon. And that's how you scan the medial elbow. I'm going to show you how to scan and inject the medial elbow, or the common flexor tendon. Patient position is supine and the affected elbow is near to you, with the elbow flexed 90 degrees. For some patients, this may be troublesome for their shoulder, so you might have to do that or pop a pillow underneath. The landmark is going to be the medial epicondyle of the humerus. We're going to place that in the center of the screen now. And the orientation of the probe is long on the forearm, with the distal end of the probe pointing towards the third finger. The movement of the probe is going to be just a little towards the hand, so I can see a nice view of the tendon, the central portion of the tendon there. I'm going to place the yellow arrow where the needle tip should land. The needle entry angle is like so, in plane, landing right where the tip of the yellow arrow is. It's worthwhile noting the ulnar nerve is safely protected behind the medial epicondyle. We can see it in the view just here. And that's how we scan and inject the medial elbow, or the common flexor tendon.